Okay, so today we're going to go through how to do a med rec on Matrix Care. I have my screen up to show you, and we can go through this together, but this is typically the process we use prior to a start of care. We want our clinicians going into a start of care visit prepared for the visit. And the most important thing, obviously, is the medications and making sure that we have an accurate medication list per the referral list that comes over from either the hospital or the rehab or the doctor's office with the patient when they're brought onto services with us. So to start, we go into clinical documents before we ever even leave our house in the morning. And we're just going to go in and we find the medication list from, like I said, either the rehab or the hospital. We're going to tap on that. And this is a very pretty version of what you would typically see, but this is something similar to what you would see from a patient coming out of a rehab. So as you can see, they have the name of the medication, the dose. For some of the medications, they actually have when to take it, which is great. And as you can see on this medication list, especially for the Novolog insulin sliding scale, that actually doesn't have anything with it. So we would need parameters in order to properly enter that into our medication list. So that would be a discrepancy. So as we're going through this medication list, we're looking for a lot of different things. We're looking to make sure the medications make sense for the patient, that everything that is needed on the medication list is there, like name of the drug, dose of the drug, when to take it. If it's an as needed medication, we want to know why it's needed. And we're also making sure that it's an up-to-date medication list. So the date on the list is within a time frame that makes sense for the patient's most recent illness. So here, this is where I would either take a photo with my phone, and that's actually the way that I'm going to do it today. Okay, so I just took a photo with my phone, but the other way that we're able to do this is we actually take a screenshot. And we save it to our photos. So now we hit done. We go over into our menu, and now we're going to go down into our medication profile. When we go down into our medication profile, you can see here, these are a lot of discontinued medications from previous uses of this chart, but we're going to start from scratch. So if we go in, we can go to add medication up the blue button in the left-hand corner. We want to make sure that our order group is correct. Our order group should be plan of care because it's a start of care. We want to make sure the physician, where it says Michael Ayers, that's the physician that's actually referring the patient onto our services. We hit done. And then we want to make sure that we tap on medication. So when we do this, we can either use, like I said, the photograph that we took on our phones, which tends to be really small, or we can pull our little station up. We pull our pictures over to the side. This is our overlay. We want to bring up the picture from the medication list, and we can enlarge it. So now I can hide this medication list as I type. As you can see, the medication name will bring up every formula that we have saved into our computer. We just want to make sure. So we're going to do 40 milligrams. And then he's going to be taking this daily. So we can do 40 milligrams, one tablet orally once a day. We're going to tap on that. And then it auto fills in for us. If we hit done, that's going to pull us completely out of the medication profile. We don't want to do that yet because we obviously have other medications that we want to add in. So up in the upper right-hand corner, we have a button that says add new. We want to hit add new. Pull this back over. Oops, sorry about that. So we want to enter in Coumadin, and we take note that's 2 milligrams. Oh, and then as we see here, so it's 2 milligrams orally Monday, Wednesday, and Friday. But then they're also going to take 1 tab on all the other days. And we want the INR to be due in 1 week. So 2 milligrams, 2 tabs, Monday, Wednesday, Friday. So we're going to type in Coumadin. And unfortunately for this, you have to type in warfarin. Sometimes you have to type in one name or the other in order to get it pulled up. As you can see, it auto-populates 1 tab orally once a day. So we're going to change 1 tab to 2 tabs orally once a day. We're going to go back. This is Monday, Wednesday, Friday. I'm going to change the frequency to 3 times a week. We're going to specify in the additional comments Monday, Wednesday, Friday. And then I always like to include patient to take. Now I'm going to double check. 1 tab. So that would be Tuesday, Thursday, Saturday, and Sunday. And I'm also going to recheck INR in 1 week. I'm going to copy that because in order to now put in the warfarin 2 milligrams 1 tab, we need to add a new medication. So again, we're going to go up, we're going to go to add new, and then we type in warfarin 2. And I believe this is 4 times a day or 4 times a week. I apologize. And this is going to be, so as you can see, I copy and pasted the note from the last one into this one. Patient to take So they're taking this Tuesday, Thursday, Saturday, Sunday. And then I'm going to put in patient to take 2 tabs Monday, Wednesday, Friday. And I'm going to keep the recheck INR in 1 week. So there's no guesswork done depending on which medication you're looking at. You always know that there's a corresponding order. That's just how I like to do it. There's no policy that states that you have to put an additional comment in. I just found in my practice that was the easiest way for me to keep track of it. So again, we're going to hit add new. I'm going to pull this over. And next we have Lasix 20 milligrams, 2 tabs daily. So as you can see again, this is 1 tab daily. So I'm going to delete that and put in 2 tabs daily. I'm going to double check Lasix 20 milligrams, 2 tabs orally daily. Every once in a while, I'll write the total dose here. Again, you don't have to do this. It's just a note that gets attached to the medication order. It just depends on how your brain works and what is easiest for you to visualize. So now we're going to hit add new again. Next is Augmentin 875. And now I'm going to have to hide that again. 1 tab orally twice a day for 14 days. So 1, and then this drop down is tab. You can see this one didn't automatically populate because I had only chosen the name. And now, as you can see, I'm going through and I'm looking, the name that popped up is incorrect. So now I need to go back and I need to adjust it. So we get rid of this. We want to scroll. In all reality, most likely it is the 875-125, but we don't have the bottle in our hand right now to see that. So we want to put this in for exactly how it was written. And then when we're in the home, we will confirm if in fact it is a discrepancy and it's not written correctly, then that's something we're going to have to contact the doctor about, write a communication note, and I'll show you how to put the care plan in for that after. So as you can see, it doesn't exist for Augmentin 175. So I'm just going to free type it in. And I'm going to tap on it. So your duration was 14 days. It's going to automatically fill in your end date now for you. We're going to fill in the form. We need to go down and find tablet. And we're going to take 1 tablet. So as you can see, everything has a drop-down menu. And we're gonna make sure that we are correct. So Augmentin 875, take 1 tablet twice a day for 14 days. So as we can see, 1 tablet, 875. I apologize, we also have to put milligram in here. We put in 14 days, and now we're gonna write orally. And it's 2 times a day. And sometimes in the additional comments, I like to put what they're on Augmentin for. So is it for a UTI? I'm gonna put it there, okay? So now we're going to put we're gonna press, add new again. And next we're gonna do metoprolol. Succinate. 50 milligrams, 1 tab, orally once a day. We can tap on it and it fills it in. But now, as you can see on the picture, it says metoprolol succinate 50 milligrams, take 1 tab orally once a day, hold for SBP less than 100 or heart rate less than 60. So we definitely want to be adding that into our additional comments. Okay. So we want to pull this back over. We want to double check our work. Great. Add new. So as you can see at this point, it's pretty repetitive. You're doing the same thing over and over again. It can be a little time consuming, but it's worth it to get all of these medications in before your visit, so that if any allergies pop up or any warnings or interactions pop up, you know before ever even going into the home what you need to address. So next is going to be the Novolog insulin. We want to do the 100 units per ml. And this just says per sliding scale. So if you take note there, we can't even fill anything in here. So honestly, it wouldn't even really be worth putting into the medication list yet. It's not going to let you fill it in. So if you look on the right left-hand side here for the little red dots, those are fields that you have to fill in order to move forward. If you don't have any information to put in there, then you can't move forward. So I would just pull my medication list back over from the side and look at the next one. So it's prednisone, 10 milligrams. This is another taper. For the purpose of this video, I'm not going to go through it. We entered in exactly how we would have entered in the Coumadin. So we have to, as you can see, prednisone 10 milligrams. Person's going to take 3 tablets for 3 days. So we entered that in as its own medication. And then just like the Coumadin, it says 2 tabs for 3 days. So we entered that in as a separate medication. And then 1 tab for 3 days. We entered that in as a third different medication. And then the patient is to stop. So now we're going to add in the Advair. And so the Advair is 250, 50. And we're going to do 2 inhalations twice a day. So again, we need to change the 1 inhalation to 2 inhalations. And we're good to go. So add new. Next is acetaminophen, 325. They're going to take 2 tablets orally every 6 hours as needed for pain or fever. As you can see here, this is an as needed medication, and it does have its indication, which is for pain or fever. So we can enter that in. We want to make sure that we find the right route. So again, we want to change the 1 to a 2. And this is caps. We'll change it to tabs because that's what it says. And we're going to tap on the little X, get rid of that, and we're going to put every 6 hours. For this, we're going to tap yes for a PRN indication. We're going to start typing pain, and it's going to come up with different types of pain, so we can't put it in. So unless you tap on one of the available options for the indication, it actually won't let you free type in here. So what you can do is you can go into additional comments and type in pain or fever. Typically, we would like for it to say pain on a scale of 1 to 4 or 1 to 3, and any fever greater than 100.9 or 101.2. That's not what we have here, and this does suffice for a reason. It's just not as good of a one as what we'd like to see. It's just not something we're going to bother the doctor about because it is a reason. So next is going to be the Pro Air. Let's see. It's the 90 micrograms. We're going to do 2 puffs every 4 hours. As needed for shortness of breath. And now you can see shortness of breath does come up on here, so we can just tap on it and we're good to go. And that is all of his medications. So we're going to finally hit done in the upper right-hand corner, not add new. So done. This pops up with all of our medication warnings. So at this point, I like to pull up from the bottom my notes. And now I pulled that over to the side because we need to be taking note of any major interactions or anything that the patient needs to know. So if we're going down here, so albuterol and citalopram. We're reading through it. Excuse me. So then I'm going to read down. So we're going to want to go over our symptoms with the patient. We don't want to alarm the patient. This is most likely a medication combination that they've been using for a very long time, and we don't want to scare them away from using their medication. So we do need to be careful but straightforward. So we want to let them know that albuterol and citalopram, they want to be watching for signs of dizziness, lightheadedness, any irregular heart rhythm, shortness of breath. And then we could go into what the patient should do if they experience that, if they should give us a call, if they should be calling 911, stuff like that. So over in here, I'm going to type in albuterol and citalopram. Now I have to fix this because Apple does not really understand medical terminology. So we're going to come down here, albuterol and I can't even pronounce that, to be honest with you. So here, I'm just going to put a little slash. And this is saying essentially the same thing. But we want to make sure that they're closely monitor blood pressure for it. So here I'm going to write monitor blood pressure, watch for side effects such as dizziness. What else do we say? Lightheadedness, irregular heart rate. So we're pulling out information that is meaningful to the patient. We're not just reading it verbatim and we're not just copying and pasting. We're pulling out information that actually means something. So here you can see citalopram is just on its own. So if we read through this, it says that alcohol shouldn't be consumed when you take citalopram. So that's as simple as what you can be with this. And you want to include this in your notes. And I just write citalopram, no alcohol use. Because that's a good enough note for me. And then we're talking about furosemide and albuterol. So for this, you can also copy and paste. So if you highlight and you go down and copy, paste, and then you read through it. Again, you're going to read through and you're going to be looking for something that's meaningful to the patient. So we want to talk about the fact that it can cause the patient to lose potassium faster and that we want to be watching for signs of that. So muscle cramps is a big one. A lot of times that's the one that I'll stick with, but so is fatigue, weakness, abdominal pain, constipation, irregular heartbeat. So we can actually take that, copy, and we can paste that right into it. That's a good note for me. So that I know going into the home that these are things I'm going to touch on without then having to go through and reread through each thing. So citalopram also interacts with furosemide. Again, I'm just going to put a slash here and hit paste. Most of the time, these are going to be pretty similar. So this is hyponatremia. We want to go down and we want to talk about hyponatremia. So dizziness, lightheadedness, a lot of times patients can have like headaches with hyponatremia, tachycardia. In severe instances, they can have like seizures, but we don't want to sit there and like scare the patient. We want them to notice symptoms before it gets that bad. If you feel like it's important for the patient, then definitely mention it. But I like to stick with ones that are going to be meaningful. So hyponatremia. And keep in mind, the patient isn't going to see the notes that you're writing for yourself. This is notes that are going to go into the patient's charts. You're going to make them look a little bit prettier when you put them in there. And they're also for you going into the home. So we're also talking about furosemide and metoprolol. So they can increase the signs of hyperglycemia, so especially patients with diabetes, and they can also increase QT interval prolongation. So basically, your QT interval on an EKG. We're not going to be doing EKGs in a home, so that's something that we might not want to bring up to the patient in this setting. It might not really be appropriate, but letting them know that serum potassium levels can be altered, your blood pressure can be altered, your glucose can be altered, and that when they're on this combination, then it's probably a good idea to ask the doctor if they want to closely be watching their labs. That's a good thing for you to ask as well. So if you're in the home and you're doing a med rec and you see something like this, then maybe that should be triggering you to ask the doctor if they do plan on following the patient with labs. Sometimes, like I said, the patient has been on this combination for so long, but the doctor is perfectly fine with it. So I'm going to write down here, glucose control and monitoring. So metoprolol, that can be enhanced by food. So they want to be taking the metoprolol at the same time every day, immediately following meals. So this is a big one to educate the patient on. A lot of times patients aren't really sure when they should be taking their medication, and they always ask us, when should I take this? When should I take this? So letting them know that they should be taking it at the same time every day following meals is a big deal. I'm going to copy. I'm going to pull over my notes. And get rid of what doesn't matter to me. I just find that faster. And now we can go through this whole long list of everything, but you really want to just be pulling out the information that matters to the patient and understand that if you're going through too much too fast without making it relatable and conversational with the patient, then they're going to get very, very overwhelmed with the technicality of it. They're going to zone out and they're not going to understand anything that you said. So really pick the stuff that's the most important. You can always follow up at subsequent visits in order to educate on other medications. So now we hit done. So this is how we enter in our medications. We now have all of our interactions and our patient education that we need. We have our medications here. We saw that no allergies are popping up, which is great. And we're ready to go in and do our visit. I apologize. So prior to going into the visit, we also need to set up our care plan. So we're going to go back in. We're going to go to our care plan. We have a new care plan item. We're going to go to add problem. We type in NVNA. And now we have NVNA IDT medication management. We want to choose that for every patient. And then we go to discipline and we choose the fifth down. You can see it says interdisciplinary team. That's the one that we want to choose. Then we hit done. So we go to medication management. We want to tap right on that, and it brings us up to this. When we add interventions, we are going to choose, for now, we're going to choose our general interventions that we're going to put on every patient. So we want to teach and reinforce to avoid all over-the-counter medications and herbal supplements unless approved by the doctor. We want to teach the patient and the caregiver about their medications and their medication management. That's everybody. We want to also assess their current medications, including any new change medications. We want to be talking about the side effects, their schedule, and their interactions. Let's see. So any patient that would have a B12 injection, we would be selecting that. If we needed to pre-pour or set up medications, we would be choosing that one. And if we needed to teach regarding the administration of anything injectable, we would be choosing that one. So as of right now, we just have the 3 selected, and we're going to hit next. We're going to hit done. And now you can see here under discipline in the grayed out box, it only says SN. We actually want to make sure that we have every discipline in there prior to going into the home. Once you select the discipline, you cannot go in and change it. It's permanent. So you would have to completely delete the entire intervention and then put it back into the chart in order to change this after you've submitted. So you want to make sure that you're tapping on where it says SN. And we want to make sure the medical social worker, I'm sorry, not the medical social worker. So skilled nursing, speech therapy, physical therapy, occupational therapy. We want to make sure that all of them are in there. And we want to be able to hit done. You have to do that for each one. Okay, good. And then we want to add our goal. Done. And again, select your target date. It's October 27th. And we're going to hit done now. So now we have our IDT medication management care plan item. That's going to go along with the medication reconciliation that you do in the home and then with the doctor. So I'm going to pause here, and I'm actually going to have somebody come and do the med rec with me so you can see the interaction that we have and what we document on. Okay, so now we have entered the home and we've asked the patient to get all of their medications together. We're sitting at the table together, and I have the printed medication list from the rehab in front of me. It should be an exact copy of this document. Nope, sorry, not that document. Of this document. So their medication list in the home should exactly match the medication list that's in the computer that we got from the referral source. So this is a document that I'm actually going to write on. If the medication that they have in the home matches the prescription on the bottle to this medication list, I'm going to put a check mark next to the med. If it doesn't, I'm going to write on this list what the discrepancy is, and I'm going to put a box next to it. So I know that I need to follow up on that medication and that it's not reconciled. That's my way of doing it. Of course, like I said, there are many other ways of doing it, but I also want to interview and quiz my patient to make sure that they understand the medications that they're taking, how it's prescribed to them, and make sure that they're safe taking it. At the same time, I'm going to just let them know a couple of things about side effects that they need to take note of. So I'm going to start. I have the patient here with me. So you're going to hear another voice, and we're going to start going through. You're going to see, I'm going to pull my notes over. I'm going to start a new note, and this is where I'm going to write any discrepancies that I find. So, hi, sir. How are you?
Hello.
So could you please tell me, and I'm looking at the bottle, I've already confirmed that the Celexa 40 milligrams, 1 tab daily is what is written on the bottle. So now I'm handing the bottle to the patient and asking them to tell me what the medication is. So that's what I'm going to do now. So, sir, can you tell me what the medication is, what your dose is, and why you're taking this?
This is Celexa. It's 40 milligram.
And how often are you taking this?
I take one daily
Do you take that in the morning or at night?
at night.
Okay. And do you know why you take this medication?
I really don't know.
So, have you had any type of depression in the past, anxiety?
Yes.
Okay, so that's why you're taking that medication. Have you been on this medication for a long time?
Yes.
Okay. So I'm going back to my notes and I'm going to let them know some of the interactions that were noted. So you're also on albuterol, is that correct? Do you take an inhaler?
Yes.
Okay, so you want to be watching your blood pressure while you're on this medication. You also want to be noting if you've had any dizziness or lightheadedness, and just pay attention if you start feeling an irregular heart rate. Give us a call, let us know if you start feeling any of those side effects.
Okay.
Thank you. So I see here that you're also on Coumadin.
Yes.
How many milligrams of Coumadin do you take?
I take 2 tabs of 2 milligrams for 4 total.
4 tabs or 4 milligrams?
4 milligrams.
So you take 4 milligrams total. What days of the week do you do that?
Monday, Wednesday, and Friday.
And then what do you do the other days of the week?
Just one.
Okay, and can you tell me what days of the week that would be?
Tuesday, Wednesday, and then the weekend.
So you take 2 milligrams or 2 tablets, I'm sorry. So you take 2 tablets, which is 4 milligrams
Yep.
on Monday, Wednesday, and Friday.
Yeah.
If you do that, then when do you take the 2 milligrams? Try it again.
All the other days.
Okay. Do you use a pill box?
No.
Okay, so if we could, I'd like you to start using a pill box so that we can monitor this. So this is a high risk medication. Do you know what this medication does?
Thins my blood.
It does. So that's high risk. If you had a fall or you hit your head, that's something that we need to know about right away. If you hit your head, you actually want to be going to the emergency room for a CT scan. I know it sounds silly, even if you didn't get a bump or a bruise or you didn't think you hit your head very hard, you still should be going to the emergency room. So we want to make sure that your dosing is correct, especially considering it looks like they may have changed your dosing while you were in the hospital. So we want to make sure that it's correct and that you understand it until we get on a normal pattern. Is that okay?
Yep.
Perfect. So I actually noticed that I'm no longer screen sharing. So I'm going to make sure that I screen share with you. Okay, great. So I'm going to write a note to myself that we're going to get a pill box. I'm also going to write that I'm concerned for, I'm not going to write concerned. I'll write patient requires further education and monitoring. Because it's very likely that he does understand how to take the medication and which days to take it on. That just talking about it out loud and being put on the spot makes him a little bit flustered. So once we've been with the patient for a little bit longer, we might notice that he does in fact know what he is doing. But these first couple of weeks are going to be crucial to make sure that he's accurately taking this medication. So I'm checking my medication list that's in the home. I have 2 check marks, one next to Celexa, one next to Coumadin. The medications match. And now we're on to Lasix 20 milligrams. I note that the prescription bottle is correct according to the med list. Sir, could you tell me what you take for Lasix?
I take 40 milligrams a day.
How many tablets is that?
2.
Good. So Here, we want to be educating the patient that Lasix, so sir, the side effects of Lasix could be dehydration, dizziness, and orthostatic hypotension. You want to make sure that you're going slow when you go from sitting to standing, and you want to stay nice and hydrated. This is also a medication that you want to be taking in the morning. It can make you pee a lot more, so you want to make sure that you're not taking it before bed. You don't want to be up all night urinating. So we mentioned when to take it, and we mentioned the side effect of the medication and what to do about it. We also want to mention the purpose and make sure that the patient understands the purpose of this medication. So do you know why you're on this?
Get rid of water.
What diagnosis do you have that might have made the doctor want to put you on that?
General heart failure.
Yes, so congestive heart failure, that's a medication that you would need Lasix for. Good, so you have a good understanding of that medication, when to take it, why you take it, and what to look out for. So we're gonna put a check mark next to that medication. So next is Augmentin, 875 milligrams. They're gonna take that one tab twice a day for 14 days. So sir, here's the bottle. Could you tell me what this medication is?
Augmentin.
How-
875 milligram.
Okay, and how often are you supposed to take that?
One tab twice a day.
Good, and what time of day are you taking that?
The morning.
Just the morning?
The morning and the night.
So what time would you take it?
When I wake up and like an hour before I go to bed.
Okay, so we want to make sure that if it's twice a day, you're taking it every 12 hours. That would be 8 a.m. and 8 p.m. would be a good time schedule for that. How many days do you need to take this?
2 weeks.
Good, 14 days. Do you know why you're taking this?
I don't know.
So you were diagnosed with a urinary tract infection when you were in the hospital. So they want you taking this for 14 days. It's important that you take it for the full 14 days. Don't stop it even if you start feeling better. Unfortunately, that's how you're possibly going to get a recurrence, and you can also develop drug resistance. So next time you get a urinary tract infection, it might be harder to treat. You also want to be making sure you're taking this medication with food, you're drinking a full glass of water, and that you sit upright after taking it for about 30 minutes. If you're able to eat yogurt for lunch while you're on this, that would be really good for you too, because it helps replace the good gut bacteria that the antibiotic strips away. Okay, good. So just for the sake of time, and for this, we're going to jump down to the Novolog. So I see that they started you on insulin.
Yeah.
Can you tell me about that? What dose you're taking and if they've given you any information about this?
But I'm not really sure. They haven't explained it to me.
Okay, so I noticed that they didn't give you any information. They didn't prescribe you a sliding scale. So that means that you need to be checking your blood sugar 3 times a day and before bed. So you want to be doing it before meals and right before bed. And you're going to be giving yourself insulin based on the number you get for your blood sugar. Do you have a glucometer at home?
Yes.
Okay, do you know how to check your blood sugar properly?
Yes.
Okay, excellent. So we'll go through that and I'll have you demonstrate how to check your blood sugar for me when we're done with the medications. But for now, it's going to be important that I call your doctor while I'm here and get the accurate dosing for you. So at this point, I would pause and I would dial the doctor's phone number in order to hopefully get the doctor's office, the nurse on the phone prior to being even done with the med rec. Sometimes you're on hold for a while, so it's good to pause and try and get a hold of somebody right now. This is also a medication discrepancy, so we're gonna want to be noting this. I'm gonna fill it in right here. No sliding scale. All placed while in home. So once I get somebody on the phone, I'm going to want to note their name. So let's say their name is Mary. I'm going to say, spoke to Mary RN at PCP office, sliding scale provided. And then I'm going to fill in the sliding scale. I'm going to write this someplace where the patient can have access to it and not lose it. And I'm going to educate the patient. At this time, I'm also going to have them dial the pen, put the needle on the pen, do their prime, so their 2-unit prime, and then dial up the pen to their sliding scale. If I give them a couple of numbers and pretend like, we're just doing a quiz. So if your blood sugar was 180, how many units would you give yourself? And I'd have them dial it up. I'm not going to have them inject, obviously. This isn't the time or place to do that. However, if they are due for the medication and I'm there and they have lunch ready for them, then why not? Most important thing though is to make sure that they know how to dial it up. They know how to put the pen, the needle onto the pen, and they know how to properly dispose of the sharps. So the next medication that I'm going to go through, again, just for the sake of time, is going to be the prednisone. You don't have that in the house. So if the patient is taking prednisone, I'm going to check that the instructions on the bottle state exactly what the instructions state on the medication list. If you note here, there's a column on the referral list that says last given. We want to make sure that that is filled in, because if the patient received any doses at the rehab prior to coming home, we need to know what day we're on in order to properly educate the patient. If that's not on there, we want to be calling the rehab and making sure that they weren't given anything prior to them coming home. So, sir, do you have the prednisone bottle? I don't see it here.
I don't have any left.
So do you know if the prescription was called into the pharmacy?
I don't know. I think it was, yeah. I think my wife called it.
Okay. So your wife called the pharmacy and they said they had it ready?
I believe so.
Okay, so do you think she'll go tonight and get it for you?
Yeah.
Okay. All right. It's a really important medication and we need to make sure that you're taking the dose on time. So you'll need to take that in the morning. We'll give you a call tomorrow morning to make sure that your wife did in fact get that. If not, we can just go through, if she's having any problems picking it up, if it's not ready yet, if there's any financial issues, we'll help you work through those. Okay, so here I'm just making a note to myself, prednisone not in the home. Patient states ready for pickup. And his wife will get it tonight. Okay, thank you so much, sir. We're gonna say that he understands his medications. Now we have noted the discrepancies. For the sake of this video, we're going to say that we did in fact get the nurse on the phone prior to leaving. We're gonna let the nurse know that the prednisone isn't in the house. The patient's wife is going to go get it. We're also going to get the orders for the sliding scale insulin. And we're gonna let them know that we need a pill box to monitor and educate the patient regarding their Coumadin. All right, I'm gonna pause here and then when I come back, I'll show you what we do with these medication discrepancies. Okay, so now we are outside of the home. We've called our doctor. We understand our new orders. We understand the discrepancies that still exist. So we're going to have to go into our care plan. And now we want to go into our NVNA IDT medication management. And now we're going to add an intervention that correlates with the discrepancy that is still outstanding. So we have one discrepancy we were able to resolve in the home, and we have one discrepancy that's still outstanding. So the discrepancy we are able to resolve in the home was the insulin orders. The discrepancy that's still outstanding is the prednisone bottle is still not in the house. So we're going to add the intervention. And the only one we really need to add is that the prednisone isn't in the home. So missing IDT, clinically significant medication issue, missing medications. It's the third one down. We're going to select that. And we're going to hit next. We want to hit done. Again, we want to go into discipline. And we want to select skilled nursing, physical therapy, speech therapy, and occupational therapy. And we hit done. So now we have that. I apologize. We also need to specify. So if we tap on it again, if you forget to do it when it first pops up, that's fine. You can tap on it again. And then we're going to fill in exactly what the issue is. So we can pull our note over from the side and we can copy and paste right into here. So IDT medication issue, prednisone not in the home. Patient states it's ready for pickup at the pharmacy. And wife will pick it up tonight. Now tonight could be any night, so we want to specify the date. So once we do that, we can hit done. So now we have an IDT intervention. So every discipline that goes in can see this issue is there. Every discipline that goes in can update it, resolve it, or add to, I mean, in order to add to it, they would actually need to create another intervention, but that would be fine. There could be as many interventions of these as what needs to be. The important piece to this is that you don't resolve it until the medication issue is actually resolved. So now we're going to hit done. If, I won the lottery tomorrow and I no longer was going to be following this patient, it's great that we have that IDT problem there for us to follow the medication discrepancy, but we still want to follow up. That prednisone is an important medication that we want to make sure the patient isn't skipping any doses. So if the patient's wife did not, in fact, pick that medication up tonight, he may miss that dose tomorrow morning. That's something that we would then need to create another problem for and let the doctor know that the patient didn't take their medication on time. It might actually affect dosing. The doctor might want to then go through and change the prednisone taper because of that. So we want to make sure that we're making contact with the patient the next day. So if we go in and we go to service schedule, service calendar, we can see that as of tomorrow, the patient does not have a visit scheduled for them. So physical therapy, occupational therapy, speech, any of our other disciplines have a visit on for tomorrow. Let's take our visit scheduled for Wednesday and claim it. And then we're going to pretend like this is a physical therapy appointment. So tomorrow they have another visit. I can go in, I can add the pop-up, prednisone in home. Question. You can also see CIDT care plan, medication discrepancy, anything. So this is if there was in fact a visit on for the next day. You're going to add it to the existing pop-up. So let's say their next visit isn't until Wednesday. If that's the case, tomorrow you're going to add a visit. You're going to do no visit made. And then you're going to write in your pop-up. So now we have a wellness call on the patient for the next day, okay? So that ensures proper follow-up to make sure nothing is missed. This process with the IDT care plan and the contact for the next day will continue until the medication discrepancies are in fact resolved. So we're keeping really good tabs on our patients' medication discrepancies so that nothing is truly missed and nothing is just like hanging out there for weeks on end that could be dangerous and cause the patient to be rehospitalized. So that is our medication reconciliation in a nutshell. This is what our medication profile will look like. Our care plan item. And then our wellness call for the next day. So if you have any questions or concerns, please contact the education department and let me know. Thank you so much and have a good day.